I'm going to probably make a diet change if there's a health concern or a potential diet recommendation. And I'm not going to know what diet to recommend if I don't know what they're eating. First step always is going to be to do that nutritional assessment as a part of my kind of vital signs.
Hey everybody, welcome back to another episode of VetFolio Voice. This episode is sponsored by Hills and features veterinary technician specialist in nutrition, Cassie Panning. And for this episode, we decided to break down a clinical case and use it as an example to talk about nutritional management for urinary issues, more specifically in this episode, urolithiasis or bladder stones in dogs. And we tried to cover not only the nutritional considerations when we're managing stones, but also considerations around pets with comorbidities, since that can be a common challenge when we're trying to figure out how to properly manage these cases. And of course, we talked about clinical considerations, but there was also an important conversation around the critical role that technicians play in helping to manage these cases. We talked about how important it is to take a comprehensive team approach to get the best outcomes, both in communicating with clients and ensuring good follow-up for our patients, while giving everyone the opportunity to learn and to grow and to thrive within their roles. Cassie was an amazing guest. I had a great time with this conversation. Let me go ahead and introduce her so we can get into it. Cassie became a credentialed veterinary technician in 2004. She earned her Bachelor of Science in Veterinary Technology Management while teaching veterinary technology at the Minnesota School of Business. Cassie has worked in a variety of settings, including specialty medicine, general practice, toxicology, and teaching. In June of 2019, she passed her nutrition specialty exam and is now a veterinary technician specialist with the Academy of Veterinary Nutrition Technicians. Cassie currently works in the internal medicine department at a large privately owned specialty hospital. Let's go ahead and get into our episode.
Are you passionate about animals and love helping people? In the fast-paced world of veterinary medicine, exceptional client communication is just as important as quality pet care. As a customer service representative, you're the heartbeat of the practice, the first and last person clients see. You provide comfort, support, and trust in every interaction. This course is designed just for you. It's interactive and practical, featuring real-world in-clinic video scenarios, engaging knowledge checks, and printable resources to give you the tools, confidence, and strategies to handle any challenge and elevate the client experience. Register today for the Certified Veterinary Client Service Representative course on vetfolio.com.
Well, thank you everyone for joining us. Thank you, Cassie. We're going to have a conversation of the Cassies here. I'm excited. Joined by Cassie Panning, CVT and VTS in nutrition. And we're going to talk a little bit about urinary here, but also some crossroads of nutrition, which I think we're encountering quite a bit. We probably always have encountered them quite a bit, but now we have more and more options available to us to be able to manage patients who are presenting with all kinds of different things. Maybe they have multiple things going on, multiple pets in the household and stuff like that. So Cassie, thanks for joining me so we can dive into all of it.
Yeah, thanks for having me. I'm excited to kind of chat with you guys about what's available and the technician's role and how we can kind of tie this all together.
Absolutely. Absolutely. Well, we decided to make this case-based because oftentimes that tends to be just a more relatable situation. So let's start with Franklin here. He is our 4-year-old male-neutered poodle, presented for plaqueuria. He's having some accidents in the house, wanting to go outside in the middle of the night, little tiny puddles, very frequently, maybe a little bit of blood. So he came in and we took a urine sample. We identified some crystals in his urine. With that being the case and given his symptoms, we said, hey, let's go ahead and let's follow that up with a radiograph, which did indeed confirm he had bladder stones. So what is the next consideration you would have in this case?
Yeah, so it's always interesting, and everybody, I think, takes a little bit different approach. So we've run the urinalysis, of course, in the clinic. As a nutrition technician, one of my first things that I'm always going to do with every patient, especially one that has any sort of a medical concern, is I'm going to get a diet history. What is this patient eating? Because is it something that might be nutritionally related? Is it potentially diet related? Or regardless, I'm going to probably make a diet change if there's a health concern or a potential diet recommendation. And I'm not going to know what diet to recommend if I don't know what they're eating. So that's one of the things that's super powerful tool that I think we just overlook in our hurriedness of the veterinary life. And we're busy out there in practice and we don't always have hours upon hours for these things, but really just finding out what is the base diet that that pet is eating can really drive that conversation down so many different paths. And it's important to know so that, again, if we're going to make a change, we want to know if we're changing for the better, because what if I'm changing my diet and they're already on a low fat diet, for example, and I think I'm recommending a low fat diet, but I accidentally increased the fat because I didn't know where they were at. So my first step always is going to be to do that nutritional assessment with a diet history as a part of my kind of vital signs for the pet that's presenting.
Yeah, absolutely. I think that's such a good point to say, we don't know what to change unless we know where they're at to begin with.
Yeah, again, it's one of those super simple things that when people hear it or somebody says it, you're like, oh yeah, that is super simple. Why don't I do that more? But I mean, I get it. People are busy in practice. We're out there, we're running, we have 15 to 30-minute wellness appointments in some situations, and it's not always something that gets thought of at the top. But again, I just consider that one of my vital signs. I get my temperature, pulse, respirations, body weight, diet history, body condition score. It's all tied into my everyday vitals.
I think one of the other challenges we run into is that there's so many options for food out there and what people are feeding. So sometimes even with that history, it can be hard to really narrow down what changes to make and what we're really doing. But, certainly if we do have a patient who has some sort of dietary need or, something that we really can identify to say, to use your example, this is a low fat diet, the owner's kind of already on that track, then I think it just makes things easier rather than, maybe something that's a little bit more obscure, but we can't know that unless we ask the questions.
Yeah, no, and again, it's one of those things that I think the more people hear it, the better we get. And the other part of that, though, is sometimes that's not an easy feat. I'm sure you've been there as well, where you go into the room and you say, hey, what food is Franklin eating at home? And oftentimes clients can maybe tell you exactly which aisle of the pet food store to go to. If you go 3 aisles down, bottom shelf, it's the yellow bag, but they have no idea what the brand name is. I had a client even just the other day that was like, well, just start listing food names and I'll tell you which one sounds familiar. And I was like, well, there's like 5,000 brands out there. How long do you have for us to sit here and play guess the food that your pet is eating? So even more important in that is sometimes getting clients to answer that question while they're still at home so that they have that bag that's there with them and sending home diet history forms with them. And that's not something that anybody has to recreate the wheel on, and I'll probably bring it up multiple times because it's one of my favorite sites, but the WSAVA, the World Small Animal Veterinary Association, has an entire nutrition toolkit that has all of these things, including a pre-done diet history form for you, so that, again, it just helps make things flow smoother. You're not creating more work for yourself. You're just using the tools and resources that are available.
Yeah, absolutely. I was going to say if I had $1 for every time I heard it's in a blue bag, and it's specifically like it's in a blue bag. And I think there's some marketing behind that. There's something about the color blue I heard about at some point. But yeah, you're absolutely right that, just getting the answer to that question can be really difficult. So I love your suggestion of the WSAVA toolkit and getting a diet history before they even walk in the door. But also, if we make that a habit to ask people about the diet history every time their pet comes in, then I think it also becomes a little bit more of a habit for them to say, oh, I didn't know last time or the last 2 or 3 times, but I know they're going to ask me this. So let me, kind of make a mental note of it or take a picture of it with my phone or whatever it may be.
Yeah, I will say that the bigger market of online platforms for buying pet food has made it a little bit easier because sometimes I will have clients be like, oh my gosh, I have no idea, but let me pull up my cart from whichever online retailer and see what we ordered the last time. So there's some advantages now to the online retail location that they can pull that up. But again, having that information is just so important. And I think, again, it's just one of those little details that is easy. I should guess maybe not easy to get, but could be easy to get that can kind of really help direct the care of that pet.
Absolutely. Absolutely. Isn't that funny too? As like on the veterinary professional side and people are like, I have no idea what the food is. And we're like, what do you mean? Like I know exactly what is going into my pet's mouth. And it's just such common knowledge and something that we keep so top of mind. And maybe that speaks to the importance of your point of making sure we're asking this question every time. If we on the veterinary professional side feel like it's that important to, really have a strong understanding of what it is that we're feeding our pets, then, all the more reason we should be getting that information from pet owners as well.
Yeah. Yeah. No, it's like I said, it's something that I personally don't leave an appointment without verifying what the diet is for the patient. And again, that really is going to help us kind of direct the rest of that treatment for Franklin here, who came in with some urinary issues. And if we don't know what he's eating, like I said, we're not going to necessarily know what the next best steps are for him if it is potentially something that could be nutritionally related.
Yes, yes. So let's get back to Mr. Franklin here. And, we decided he has bladder stones and, we're seeing crystals on our urinalysis. He's definitely symptomatic. So before we dive further into dietary management and things like that, can we take a quick detour and talk about some of the more common types of stones and crystals we should be on the lookout for, and some of the food considerations that might come up surrounding those common types of stones and crystals?
Yeah, so finding out what type of stone it is really is also going to help direct that plan from there. And of course, we know that there's no 100% definitive way to determine what that stone type is without having it removed and analyzed. But there are some amazing tools that we now have that are available. The University of Minnesota's Urolith Center has not only on their website, but they now have an app where you can go in and you pull up and you punch in Franklin is a 4-year-old male neutered poodle, put in kind of that information, and it will give you the top stone rule out types. Like, we think that in this patient, it's 68% going to be a calcium oxalate stone, or we think it's 20% going to be a calcium oxalate stone. And that really can kind of help you drive your plan of what your next best steps are. The other fun feature of the app that's kind of fun to play with is with that x-ray that we took, you can take a picture of that x-ray and upload it into the app, and it will also tie that into its algorithms to let you know with high probability, now again, not definitive, but high probability, the type of stone, so that again, you can kind of start to narrow down, is this something we can treat nutritionally, or to remove this, nope, it has to be removed either lithotripsy with urohydropulsion or surgery to be able to get rid of that stone, because we know not all stones are dissolvable. In fact, most are not dissolvable, but there are some that are. So if you know what your stone probability is, that's definitely going to help you direct what your next best steps in your treatment plan are going to be.
Absolutely. No, and I actually completely forgot that option existed until we started talking about this and went, oh, yeah. And that's such a handy tool because especially, in a dog like Franklin, who is symptomatic, and we really don't want to drag this on for any longer than necessary. Not that we would want to drag on stones or crystals longer than necessary in any patient, but certainly one that is showing signs of discomfort and plaqueuria and things like that. We really want to choose the most effective plan right off the bat, but surgery is a big deal. Certainly it's a surgery that's done very commonly and animals tend to do really well with it, but it's still surgery. So if we have the option for a dissolution diet, that's great if that's the right way to go in this patient. But if not, man, it's so nice to know that sooner rather than later. So I love the idea of really being able to narrow it down and have somewhat of an idea of what might work and what might not.
Yeah, it's great because, historically, we've always just looked at the pH and what is the specific gravity, and that's given us some clues. And we've had some, breed tendencies that we look at specific breeds of dogs and we think, oh, it's going to be much more likely a calcium oxalate versus a struvite. Or again, in our dogs, we look for that evidence of infection. And if infection is present, it hints a little bit more that it's probably a struvite, but we also know there's compound stones out there, and just because maybe the outside of the stone is a struvite, the inside might be a calcium oxalate, and maybe we'll make some progress with clearing the infection in a dissolution diet, but we're never going to get the center of that stone if we don't, surgically remove it, or again, your hydropulsion for something that's a little less invasive, but again, based on the stone size, right? You can't urinate out those giant stones no matter what breed of dog you are. Sometimes surgery is your only option. So I think using a lot of those tools and resources that we have. And again, I've not met many people now that don't have some form of a smartphone with them on the clinic floor. And again, it's just where our lives have changed, and it's a free app that you download from them. And again, punch in either your patient demographics or whatnot so that we know what they are, or again, just taking that x-ray or a picture of that x-ray can really help kind of narrow that down and direct your path of what you're going to do next, or how you're going to talk to those clients about what the next potential steps are.
Well, with Franklin here, we did all of that and said this stone, assumingly is struvite, might be amenable to a dissolution diet. And so the owner said, well, I'd really like to try a dissolution diet prior to talking about surgery for removal. But there's kind of an extra caveat here that Franklin has allergies. He's done an elimination diet that showed he does have a sensitivity to chicken. So he's on a hypoallergenic diet. If that's the case with Franklin, how do we then go about thinking about dissolution diets when maybe we have a dietary sensitivity or some other comorbidity that we're treating nutritionally?
Yeah, and that's where it gets tricky, whether it's a struvite or a calcium oxalate. If we think it's struvite and we're going to try to dissolve it, most of our dissolution diets are not food allergy friendly. And again, whether we know Franklin has a true food allergy, that he's done the full, elimination trial, the challenge, etc., or we just know he's done really well on a hydrolyzed diet or a hypoallergenic diet of choosing for him. And we don't know maybe what that trigger is. The tough part is do we really want to potentially make his skin or his GI tract worse while we're working to dissolve the stone? And while some of those dissolution diets do work fairly quickly, 14 to 21 days for some of them, is it worth it to kind of set Franklin back? So I think in these cases that we have these comorbidities or pets that need these specific dietary needs, that we really have to look at what is kind of our triage, what's going to be more important. Can we get that stone out quickly with surgery? Yeah, we can. And that's not probably going to disrupt his skin or whatever his signs were. Maybe he has vomiting and diarrhea with his food allergies. We're not going to create a secondary problem or bring back a secondary problem when we have other options. So again, that's where kind of knowing his history, that we know he eats a hypoallergenic or a hydrolyzed diet, lets us know that a dissolution diet trial in him might not be our first steps to treatment, because there are other issues that we might make worse at that time.
Sure. So, just kind of keeping that in mind, we do have a lot of nutritional options that will manage comorbidities, but in some cases, we are going to end up in a spot where we might risk setting them back depending on how sensitive he is. And, maybe in those cases, we need to have a different conversation with the pet owner to say, what's going to be the best thing for your individual pet. But, I think it circles back around beautifully to that first point we were talking about, of the importance of knowing in the first place what he's eating.
Yeah. And again, it's a little bit client dependent too, right? Maybe cost is a huge factor for them, and they're okay with Franklin having a re-onset of his diarrhea to get rid of the stone and see if that works. Maybe the diarrhea was just so horrible for Franklin. They're just like, no, absolutely not. I could never go through that again. I will do whatever it takes. It doesn't matter if it's surgery. We'll leave him in the ICU for a few days. That's not an issue. So you have to kind of meet those clients with where they're at, not only financially, but also within what's going to be best for Franklin. Now, if Franklin truly has uncontrolled vomiting diarrhea and is going to land, a 7-day plus stay in the ICU from changing his diet, that's something to consider within the costs of whether or not surgery or something is more affordable or safer for Franklin. But again, really kind of looping everybody in isn't going to be in benefit with that, of what their goals are, and ultimately keeping Franklin at the forefront of our most important piece of what we want to take care of.
Absolutely. Absolutely. Well, let's continue a little bit further down that line of thinking with these multiple comorbidities. This owner's feeding a hypoallergenic diet. Franklin's really well managed on it, but this owner likes to give treats. And they were told when they went on this hypoallergenic diet that most fruits and vegetables are safe. Is that still going to be the case now that we know about these bladder stones?
Yeah, and some of that's going to circle back, right? So again, if we're talking struvite stones, which we know primarily in our dogs tend to be more of a stone of infection, but let's say we get these stones out, we went the route of surgery, and he's staying on a hypoallergenic diet, and the owner still want to do treats. If there's any component of like calcium oxalate or other stone component to that, it might not be appropriate to say, yep, you can still feed some fruits and vegetables. What we know with a lot of pets that are sensitive to their diet, it's the protein sources that they tend to be most sensitive to. So that's where historically we've heard veterinary professionals say things like, yeah, fruits and vegetables are fine with a hydrolyzed diet, but you have to be careful because if you don't specify, there are still going to be the owners that then, oops, I fed some grapes to my dog, which we know are toxic, but we didn't specify that. We just said fruits and vegetables. So you have to remember that just because it's common practice for us that we are like, oh my gosh, what do you mean you fed grapes? We've known for years those are toxic. There are still owners out there that didn't get that memo somewhere in their pet owning career, or maybe this is their very first dog ever and they've never looked into it to make sure that we're staying on top of it. And then you also have to think about, again, the type of stone. So if we switch and say more that this was a calcium oxalate in Franklin, we need to make sure that we're not feeding human foods, fruits and vegetables that are high in oxalate content. Because again, then once we've taken out that stone, we have them maybe on a combination diet that's going to promote an environment that's unfavorable to stone growth, that's still hypoallergenic. If we're then slamming him full of things that are high in oxalates, we're still kind of then undoing the therapeutic goodness of that diet from them. So using resources out there, the University of Guelph has a great resource that I've kind of included here that lists foods that are okay to feed in limitations, foods that are okay to feed, and then foods that are really high in oxalates. So again, most berries are high in oxalates. So when we think about that, a lot of dogs love strawberries and blueberries, but we need to, again, be careful if those are the fruits and vegetables that we're choosing to feed to our pet based on what their diet is. So it's more than just here's your therapeutic diet and fruits and vegetables are okay. We have to be very specific with our owners because if you didn't say it specifically, then they're going to take a little bit of grace within what they think is acceptable and what they think is healthy.
Yes, no doubt about it. I think that's such a good reminder. I don't know. I wonder if I should admit this on this recording, but really the oxalate containing vegetables in particular is sort of a new thing that I've had to deal with recently in a patient. And disclaimer, it wasn't a patient with urinary issues, but he needed to lose some weight. And how often have we recommended, green beans or something like that to say, yeah, just, feed him some green beans to help fill him up, give him a fiber source and things like that. Turns out those are one of those high oxalate containing vegetables. And this was the patient I'm thinking of. He didn't have urinary issues to begin with, but when they fed him green beans, he did. And so some are more sensitive than others. And yeah, that was something new that I had encountered off of a recommendation, I've made plenty of times before with no issues.
Yeah. And again, it's one of those things where the other piece to keep in mind within kind of even that realm of things is kind of the balance, right? Because we still want the therapeutic diet to be 90 to 95% of that pet's intake. And of course, in some of our urinary things, we definitely want it to potentially be closer to that 100% just to ensure that we're not, again, accidentally undoing that, but really kind of reminding clients of those sorts of things of, yeah, you can feed some of these, but again, it has to be in moderation so that we're not exceeding kind of that 5 to 10% total caloric limit for the patient, or again, even exceeding their calories, because we like to think of all fruits and vegetables as these healthy, low calorie foods, which mostly they are. But if you feed a dog enough green beans, for example, they can still gain weight because there are still calories there, right? So it's not a calorie-free food. So it's all about keeping things in that balance to not undo all of the hard work and therapeutic goodness that the scientists and researchers do to put into these diets to really help our patients.
Such a good reminder to make sure that like you summed it up beautifully to say what we tell owners we need to be specific because they're going to take a little bit of leeway in what we say. And if we're not specific and we say, oh yeah, fruits and vegetables are fine without saying, watch out for these specific ones, whether it's grapes because they're toxic or, others because they're high in oxalate and can cause other problems, or to say, also, these are, like you said, they're not calorie free. We do need to make sure that we're maintaining only a certain amount of them and not just feeding them completely ad lib. Those, I think, are very easy to take for granted as things we think about all the time, but maybe aren't intuitive when we're explaining this to pet owners.
Yeah. Again, it's one of those that, again, if you don't say it, you can't assume that they just know it, even though in the veterinary profession, we've known it maybe for years.
Absolutely. I feel like that applies in so many areas of life. If you don't say it, you can't assume that they know it. It's just a good rule in general. Well, you have a lot of these conversations with pet owners and, work closely with veterinarians who are trying to make good nutritional recommendations for these patients and keep everybody on the right track. So I would love to hear more about that. Can you elaborate on the technician's role in working up and managing these types of nutritional questions?
Yeah, that's a great point to bring up because I think a lot of technicians should be very empowered in this area. And there's a lot of shift in focus in some of the CE talks about making sure that we're doing tech utilization and within tech utilization, doing proper tech utilization. Because again, there's really limited things that we can't do. We can't prescribe medications. We can't give a prognosis. We can't do surgery and we can't diagnose. So there's limited within what we can't do from within the guidance of our veterinarian. Now, depending upon your state's Practice Act, make sure that you're taking that into account before you go rogue with any of these sorts of things. But for the most part, that's kind of the broad what we can't do. So when you have a great working relationship with your veterinary team, there's a lot of these things that you should be able to do. So in Franklin's case, when he comes in, the technician, again, should be getting the history from the client. What do these urinary accidents look like? How is he having an increase in frequency, an increase in volume, or both? Is there blood in the urine? When did these signs and symptoms start? So getting that detailed history to really start kind of tying in with the veterinarian, what is going to be our working differential diagnosis list? Now, of course, I'm not making the diagnosis, but that doesn't mean I can't work hand in hand with my veterinarian to say, hey, based on these signs, I think Franklin might have XYZ. What do you think about us taking an X-ray? And having the veterinarian actually recommend that, but really helping kind of tie those next steps together. But the technician should absolutely be able to collect the urine sample, whether that be a free catch sample, a catheter sample, or a cysto sample. That's definitely something that should be within that realm of skills that the technician has. They should absolutely be able to take those radiographs. And I think most clinics now, I think it would be rare that many just do in-house analysis, but then send them for a reading by a radiologist. Now, again, if you take that x-ray and there's big giant stone glaring you in the face, you may or may not need to send that out for a radiologist to tell you, yes, this dog has a bladder stone. But again, I think most veterinary clinics now are sending out rads. So again, definitely things within those steps that the technician can also do. While within that realm, because I took the x-rays, I can absolutely pop out my smartphone and pop in Franklin's information and then take a fun picture of the x-ray and upload it in there and see what is going to be the most likely, so that, again, if it comes back as it's going to be 60% probable of a struvite based in this case, or 60% probable calcium oxalate, then I can say to my doctor, hey, we need to talk to this client a little bit more about what their goals are. Are they hoping to do minimally invasive procedures? And do we do those here? Because if you're looking at doing minimally invasive lithotripsy and hydropulsion, that's not something you're going to do at your everyday clinic. But again, I think a lot of general practice clinics are comfortable with doing a cystotomy and removing that stone, as opposed to, again, did the owners really want to avoid abdominal full surgery for that sort of thing? So that's an education piece that, again, the technician can have that conversation with the client. They can talk about some of those risks and what the options are for them. The technician absolutely should be doing the nutrition consultation with these clients. And again, what is your pet eating? What is kind of the lifestyle of your pet? Are you giving a lot of treats? Because maybe these clients were already feeding what we consider urinary friendly diet that has a lot of the multifunction coverage of it's a hydrolyzed diet, but it also has urinary protection in that diet. But they were loading on the green beans, or they were also feeding lots of celery and cucumbers and berries and things that were pushing all of these extra oxalates into the system for that patient. So kind of coaching them through that and digging through all of that information. Because even in all of my years of doing kind of nutritional consults with the clients, there's always, if you don't ask the questions in the right way, there's always something that they hold back. And it could be, again, if you just ask, what diet are you feeding? Oh, I'm feeding XYZ over the counter diet, or I'm feeding this hydrolyzed diet that my veterinarian recommended. But if you don't get into a little bit more detail of what is that pet's daily routine, you're going to miss the part of, I have oatmeal with blueberries on it every morning and my dog gets a handful of blueberries with me. Or at dinner time, I make 2 pieces of toast as a pre-dinner snack and my dog gets one with peanut butter on it and whatnot. And peanut butter, again, high in oxalates. So if we're not really kind of looking through the whole diet history or what their routine is, clients really only like to tell you what they are feeding, or what they think they should be feeding, I should say, more so than what they are feeding. I every once in a while get a client that's like, oh, I hate to admit, but I also give these treats. And I'm like, don't hate to admit it, you're being honest. Like when clients come in here and say, I strictly only feed this food, there's not many of them that I truly believe, because we're human. We all love to share food with our dogs. From that side of things, it's just a part of our human animal bond that we're working with them. So again, if clients aren't telling me, I usually try to press them a little bit harder. Now, in Franklin's case, having a known food allergy, maybe those clients really are strict to that diet. And those are the cases where I might buy that. But again, maybe they were giving some of those high oxalate treats.
I think you illustrated some really important roles there. Like I'm picturing, if I said, hey, we're finding crystals and I want to look for bladder stones, and to, have a technician say, okay, I'm going to get these x-rays and get them set up to send out if that's what we're doing, and go ahead and put the information into this app to get the probability. Let's have a conversation about what these recommendations are going to look like, and then go have those conversations with an owner. I mean, that really empowers the technician to say, hey, you have a very important active role in managing this case. It frees up the veterinarian in a big way. So if you're someone like me who is constantly running behind in rooms because I just like to talk a lot and I have a lot of information that I feel like needs to be shared in those appointments, then having a team member like that who can say, all right, I can take it up to this point, and then buys me time to go do other things. The client's getting all the information that they need, and then we all end up on the same page in the end. I think it provides better service for the clients and better patient care overall. And I also could not agree more with you about pressing a little bit on those food histories, because I also have a lot of understanding for people who only want to tell you what they think they should be feeding. I get it. Maybe sometimes we all fudge things in our answers to questions like that. I know one way I have narrowed down some of those answers before has been to say, I say, well, do they get any treats? What kind of treats are you giving? Well, just, every now and again, they'll get this little whatever it is. And I'm like, okay, I need you to tell me what every now and again means. Is it, a couple times a week? Is it a couple times a day? And it turns out actually every time the dog goes outside, they get this treat when they come in. And that paints a whole different picture than, like you said, peanut butter before dinner every night is a lot different than a milk bone 2 or 3 times a week. And so really getting an idea of what that frequency means to the pet owner helps us make good recommendations and end up with good results for their pets.
Yeah, I like to ask that question. I was kind of taught you're going away on vacation and I'm coming over to take care of your pets. And I want to capture the essence while you are gone. I don't want your pets to really know that you're not there. So tell me everything that your pet gets from the time you guys wake up to the time you go to bed. And that might include, again, the handful of blueberries with breakfast. And even if I'm not eating blueberries for breakfast, maybe you do. So I need to know that so that I mimic that in the routine. Or every time he goes and lays in a certain spot, he gets a special treat because that's part of the training we've worked on. And really kind of tell the owners that you just want to recreate their daily routine, so that you could mimic it exactly if they weren't there. And sometimes they come out a little bit more with a lot of that information so that they're really trying to share. And again, the biggest thing we have to remember is when we're asking these questions is we're not going to pass judgment. If the owner says, I give my dog a whole piece of toast with peanut butter on it every morning, you can't be like, a whole piece of toast? Like, that's a lot of bread for your dog. Like, okay, great. Like, you mark it down, you don't pass judgment, and you kind of log it and move on. And then if need be, and you need to come back and change some of these things, you find out if there's a specific attachment to that and how we can make that still part of their day-to-day routine. But again, the second you pass judgment on a client telling you what they're feeding their pet, then suddenly they're done and there's no more treats and they were only feeding their food. So we really want to have that open line of communication.
That's such an important piece of the puzzle. I couldn't agree more. So let's jump into another potentially challenging area that we can encounter when we're talking to clients about maybe making adjustments to their dog's routine. Along with comorbidities, we also have to consider multi-pet households. So what would you say, or how do you counsel owners who say, well, I can't feed that prescription diet that you're recommending because I have multiple pets and I can't keep them separated? Maybe they all eat out of one giant gravity feeder, which again, like, I really have to take a deep breath and control my eye twitch when I hear that, because usually we're dealing with weight issues and things like that in those cases. But I digress. So yeah, maybe it's one giant bowl, or they eat out of each other's bowls and they can't keep them apart. How do you talk to owners about that?
Yeah, I will say that comes up a lot where we have clients that are like, oh, well, is this diet also safe for my other dog or cat in the household? Because I can't feed them different. And really then kind of going back to the why. Why can't you feed your pet separately? And maybe again, in this situation, maybe it's a multi-cat household and you're right. They just leave the food out free choice. Either they have overweight cats or they have those like rare few that actually are able to eat and graze and maintain a lean body weight. And they don't want to change, or this is how it's always been. So in those cases, I will talk with clients about how each pet has different nutritional needs. There's similar base nutritional guidelines, right? We know adult cats all need the same vitamins, minerals, protein, etc. It's not like one cat needs more vitamin A per se than the other in a specific situation. They have the same base needs, but individually they all have different calorie needs. They all have different potential health considerations. And especially if there's multiple pets with medical concerns, they might all need different dietary needs. So first we talk about, is it at all possible? Because we have huge kind of advances again in our technology from where we were 20 some years ago when I started in vet med. We have microchip feeders. We have RFID tags. We have all sorts of different kind of smart devices. There's a company that just launched one that supposedly has facial recognition to feed your pets. And it's just kind of, I'm waiting for that one to be launched to look at it, because I'm like, I don't understand how it can recognize. What if you have like 3 all black cats? How does it know which one is which? But so there's new technologies always coming for those sorts of things to be able to do these separate dietary management or separate diets for your pets. Now, I also want to meet my clients where they're at, because if you have 5 small dogs or 5 cats, buying each one of them their own feeder does add up financially, and we can't always make that happen. But if you have 2 pets, maybe it's a little bit more feasible to get like microchip feeders or the feeders with the RFID tags. But then it's getting to that creativeness within there. If we can't buy the separate feeders, if they're dogs and they're meal fed, can we put Franklin in the bathroom with his bowl while he eats breakfast and the other dogs in the kitchen, or just separate rooms? Maybe they have their own crates. Sometimes people will train their pets to eat in their crates so that that's their safe space. So maybe we shut them in their crates while they're eating. So different barriers from that size. Or Franklin's a poodle. Let's say he's a toy poodle and the other dog in the household is a Great Dane. Well, maybe we get a baby gate with the little cat door that Franklin's food's on one side, and so the bigger dog can't get to that food. So there's many different tips and tricks to talk to about clients of how to feed their pets separately. I wouldn't say that it's truly ever impossible. It's what the owners want to help make possible. And meeting them at those levels is where you have to kind of figure out that balance. But the other piece to that is you just want to look at your diet in specific. So in Franklin's case here, depending upon what ended up, we might recommend like Hill's ZD for that pet. It has urinary protection to try to help bladder stones from going forward. It's a hydrolyzed diet. It would fit his needs. And the other dog in the house is a 5-year-old poodle with no health issues. Well, I'm going to go to the AFCO statement. I'm going to go right to my AFCO statement that says that feeding trials say that ZD provides complete and balanced nutrition for maintenance of adult dogs. Well, that right there tells me that it's appropriate and it's undergone feeding trials, not only for Franklin's case, but also for your healthy dog. But then I will also break that down for the client of our therapeutic options are not inexpensive. I don't like to call them expensive, but they're not inexpensive because of all the science and research that goes into them. Is it cheaper to invest in a microchip feeder or to go through twice as much food that's not necessarily needed? But in this case, if the owner absolutely insisted they wanted to feed the same diet to both pets, it's safe to do so.
So I think what I hear you saying is really we just have to counsel these owners on why we're making the recommendations that we are and figure out what is going to work best for them. And in a case where one pet has to be fed a specific diet, if that diet is complete and balanced for the other pet in the household, then, that's certainly something we could talk about with pet owners to say, if you don't want to change anything and they free feed and you want to feed both pets this food, that's completely fine. But, to your point, making sure that we're talking about all of the options and all the considerations, this could potentially, increase your food bill depending on what you're feeding now, because like you said, there's a lot of research that has gone into these foods. And so is that the direction you want to go? Or do you want to explore some of these other options? It was probably within the last, I don't know how long microchip feeders have been available, but I would say probably within the last 2 or 3 years that I learned about microchip feeders and waterers and things like that. So if I just learned about them not too long ago, and this is an area where I spend a lot of time, then pet owners, they probably don't even know that that's an option to use these different technologies. Or I've used this example before. I was in a behavior lecture and I said, my dog keeps getting in the trash and it's random and I can't clock it when he's going to do it. It's just random. And person said, well, can you just put the trash can in the closet? And I was like, well, yeah, I can. And they said, simple solution. So something like a baby gate with a small hole in it that one pet can go in and out of, it seems like a really obvious solution, but it might not feel obvious to that person. This may feel like a lot for them to absorb and a big hurdle that they're trying to jump. And just sitting there and talking to them about the different options that are available, like you said, we can get a really good idea of what their priorities are and what's important to them and help them meet those needs in a way that is very personalized and works for them.
Yeah. And like you said, there's so many new technologies out there and things that are always coming within our smart pet product lines that you could have your house completely teched out to monitor your pets completely. We have monitors now in veterinary medicine that will monitor your vital signs for you just by attaching it to the cage while we're in an ICU setting. So we have so much more technology just available, period. And then, of course, the science of nutrition is always expanding for those sorts of things, just kind of circling back to the feeding the diet to multiple pets. If at the end of the day, you're not sure, guess what? The company's going to know. So use their resources. They have these support lines that you can call. One, they can tell you what their opinion of the best diet for Franklin is. And then you can say, well, Franklin also has Bobby at home, his brother dog, and he doesn't have any health problems. Can I feed that same diet to both dogs? And their support line is going to say, yes, we think that's appropriate based on this information, or actually, we really wouldn't recommend that in this case, and here's why. And then you also have that snippet of information to go back to the client and not just say, my opinion is. The science and researchers have said, here's the reasons why we really need to feed them separate, and circle back to some of those other options.
Sure. Yeah. Just had the opportunity to make that phone call many times. And, whoever is on the other end of the line has been amazingly helpful. It's gotten me to the correct answer much faster than me trying to find the information myself. And it's been probably more accurate than what I would have found on my own. And more empowering, just like you said, this isn't just my opinion. I made the phone call, I talked to the experts, and this is what the recommendation is. And, that tends to carry a little bit more weight sometimes in those conversations, all super important points when it comes to having these talks with pet owners.
I think the more that we can portray that we have the information, and if we don't have the information, that we have the tools to get that information, because then we can really also start debunking some of those myths out there that veterinary professionals don't know anything about nutrition from that side of things. Because if you go at it without confidence, your pet owners are just going to buy into that fact that, well, my veterinarian wasn't confident in the answers, so I went down the street to local pet food retailer, and the kid at the pet food retailer store, he had a lot of confidence when he sold me this diet. And whether it's the best diet or not, it's a lot about how you sell it and the information you have.
No doubt about it. No doubt about it. Gosh, that's such an important point, and potentially the jumping off point for a whole nother podcast conversation. But Cassie, this one has been great. I think a lot of really helpful information, considerations, just simple things that we can keep in mind that make our lives easier, make our clients' lives easier, and then pets' lives better. So thank you so much for joining me. Are there any final thoughts you want to share?
I don't think I have. I think I got most of it in there. But again, just reminding everyone that power of a diet history from that side of things. And don't forget to empower yourselves as technicians and veterinarians. Find those technicians that want to be empowered, because in the long run, it's just going to save you a lot of time if they can take over that client communication piece for you.
Absolutely. I think that's great advice. I want to say a huge thank you to Hills for making this episode possible. Cassie, thank you so much for joining me and the great conversation, the wonderful information. It was just a pleasure to talk to you. And of course, thank you to all you listeners out there for tuning in. I hope you enjoyed this episode. If you did, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other content we try to put out there. If you want to hear more episodes, you can click on the education tab on the VetFolio website or find us wherever you get your podcasts. As always, of course, I want to hear your thoughts on this episode and ideas for topics you'd like to hear from us in the future. So email me at dvm@vetfolio.com. We can also connect on Facebook at Dr. Cassie DVM or on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.